Learn to answer next-gen NCLEX cases from expert test masters only here at GRA.
We're still at the same case study, but we have updates. Okay, so our update here, the client labor progression is stable. No complication noted, fetal heart rate showing reassuring pattern. Client is encouraged to empty the bladder as often as possible and to ambulate. Remember, if the bladder is full, it prevents the labor progress. So that's why you need to empty the bladder. Health teaching on proper breathing techniques are also done. At 1600, the client is in the active phase of labor. Contractions regular, frequency of contraction is every 5 minutes, duration 60 seconds, interval per contraction is 3 seconds. Cervix is 90% effaced, 9 cm dilated. Fetus is at the 0 station. Okay? Regular maternal vital signs noted, IV fluids maintained, fetal heart rate monitored. Client opted for an epidural analgesia for pain management, which was administered successfully. At 2000, contractions are regular and intensifying. Frequency of contraction is every 2 minutes, duration of 90 seconds. Cervix is 100% effaced. Now, when you say effaced, it means it is short and thin. No? It is short and thin. Okay? Now, in actual practice, you would know that the cervix is 100% effaced if you touch your forehead. No? Go ahead, try and touch your forehead. You see that it is soft and malleable. No? Once you touch the cervix and you feel that it is soft and malleable like your forehead, that is 100% effaced. Okay? The fetus is engaged. Okay, so what does that mean? No, the fetus is at the ischial spine. No, the fetus is at the ischial spine. Client states that he needs to bear down. Client was transported to the delivery room. Regular maternal vital signs noted. Okay, fetal heart rate was also noted. So we are now at the delivery phase. The cervix is dilated and we are at the +2 station. Client is actively pushing during contractions. Fetal descent progressed steadily. Fetal heart rate remained reassuring. Provide guidance and support during the pushing phase. The nurse provided guidance and support during the delivery phase. Select 3 nursing interventions that are necessary for the nurse to perform. Okay? So that is a positive statement, meaning you are looking for true statements. No? You are looking for safe statements. No, safe. Okay? Inform the client to bear down prior contraction. Is that safe? To bear down prior contraction? No. No? When should they bear down? Is it before the contraction or during the contraction? Dapat during, correct. No? Mali si prior. Prior means before. Okay, next. Prepare the appropriate ID once the client is transferred back to the room. Is that correct? Should you prepare the appropriate ID during the second stage of labor or the expulsion stage? That is incorrect. Tama kayo. You're right. No. So this one should be done once the baby is out. No, not when you are delivering the baby. Okay, so this is too early. Okay, too early. Next, once the newborn is delivered, you have to check the mouth and the nose for secretions. Yes, because the priority here is the airway. Okay, the airway. To ensure proper breathing, inform the client to inhale in the nose and exhale in the mouth. Is that the proper breathing during the delivery of the baby? Inhale in the nose, exhale in the mouth. Ganyan. Is that correct? The answer is yes. No? Why should we teach this patient how to properly breathe? Because if you don't teach the patient in labor how to properly breathe, the most common type of breathing that they will perform is hyperventilation. So they will just keep panting in the mouth. Ganyan, no? And that is not good. Once the patient starts to hyperventilate, now remember, hyperventilating does not mean that you are intaking oxygen. No, it's the opposite. You are removing carbon dioxide. So that's why you tell them to breathe in the nose, because breathing in the nose is the best way to receive the best amount of oxygen, and exhale in the mouth, because exhaling in the mouth expels the most amount of carbon dioxide. So that is the proper way of breathing. Okay, next. Perform the Brandt-Andrews maneuver to prevent laceration of the perineum. Is this correct? No, is this safe? Brandt-Andrews to prevent laceration of the perineum. That is incorrect. No, that's wrong. Okay, what is the proper maneuver to prevent perineal laceration? Very good, no? It's your Röntgen's maneuver. So take note, in OB, especially in labor and delivery, there is so much maneuvers. Okay, there is so much maneuver. Okay, we have your Brandt-Andrews. Okay, Brandt-Andrews is for placental, no? It's for placental delivery. We have your Röntgens, no? Others would say Röntgens. That's fine, no? Pronunciation is not part of NCLEX, but Röntgens prevents laceration of the perineum. Okay, it's where you apply pressure on the perineal area using a gloved hand and a towel. Okay, you put that there. Next, we have your modified Röntgens. Okay, so modified Röntgens, this is for preventing precipitous labor. No, precipitous labor is a labor that is very quick, no, very fast. Precipitous labor is dangerous for both the mother and the baby, because can you imagine if you expel a baby that quickly, that's going to cause hematoma, no, that's going to cause trauma in the vagina and in the baby. So modified Röntgens is applying direct pressure on the baby's head, on the crown, as you are delivering it, to prevent it being expelled out quickly. No? We also have your Mac Roberts. I think I'm already hungry, no? I'm thinking that different Mac. Okay, so Mac Roberts maneuver, no, is a maneuver to prevent shoulder dystocia. No? This is where you position the mother, no, knee chest, and you apply direct pressure on the suprapubic area. This will relieve the pubic bone to allow the baby's shoulder to get out. Okay, and there is so much more. So please do not forget the different maneuvers and what they're used for. Okay, so again, to facilitate the extension of the head, the nurse performs the Röntgen's technique. Is this correct? Of course, because this is the only remaining third option. No, because you need 3. So that is also correct. Not only is the Röntgen's maneuver used to prevent perineal lacerations, but Röntgen's maneuver facilitates the extension of your head to aid in labor. Okay, so the answer here is 3, 4, and 6. Again, do not forget the different types of maneuver that is used in labor and delivery.
Follow us for more of this and learn with confidence only at GRA.